During the discharge of a patient aged 64 in NDH, the nurse missed in administering cardiac medication. 3 weeks later, ward staff discovered and contact the family member to get it back. Patient fainted on the same day and died after resuscitation. No staff had reported the incident before discovery.
Hi Wardman, it's a serious issue.
Yes, I think we need some changes.
Yep, I will follow your plan.
But why do we have to change? Following are the 4 reasons to change.
Let's start the change with the use of Lewin's stages. Lewin's stages consists of 3 stages including unfreezing, moving, and refreezing. And we integrate these stages with the cycle of change, which starts with assessment, planning, implementation and evaluation. In order to find out the possible causes of the incident, root cause analysis is used.
First, let's take a look at Don Abedian's theory of quality management. It's separated into 3 parts: structure, process, and outcomes. And now, we focus on structure, which is one of our possible causes of the incident, the task factor. Let's look into the guideline and procedures of handling discharge medication in North District Hospital. First, doctor will print out a list of discharge medication. Then, nurses are responsible to check with PMOE to see whether they are identical. For patients that require needs service, drug will be delivered to the ward. After checking those drug, they will be placed in a red box. When patients are ready to leave the ward, drug will be given to patient from the red box. A chop is applied on admission book for staffs to fill in discharge information, including destination, needs required, any follow-up or drug, and who is the contact person. After looking into the discharge procedure, 4 possible task factors are identified. First, there is no discharge checklist in NDH. This may easily miss out steps when discharge. Second, the column provided in the CHOP is so small that some remarks may not be able to be jotted down. Third, there is no countersign in discharge checklist, which may lead to medication error during discharge. Last, there is no regular or unannounced inspection to audit the procedures of discharge in NDH.
After discussing the task factors, let's go back to Don Abedian's theory of quality management. Technical process is included in process part, which is one of our possible causes of the incident, the educational and training factor. First, nurses might not have adequate knowledge and be familiar with the discharge procedure. Second, there might be not enough frontline staff training on incident awareness and reporting.
After talking about the educational and training factors, let's go back to Don Abedian's theory of quality management. The process part involves interpersonal process, which is one of our possible causes of the incident, the communication and individual factor.
Excuse me. My relative Champai Man was discharged from this ward last week. However, there was no medication for him upon discharge. Could you please help me check it?
Oh, I remember that the doctor did not prescribe drug for him.
It would be good if you could help me confirm, please.
Don't be worried. Not every patient has discharged medication. If you don't have other inquiries, I have to finish my work first. From the scenario, ineffective and insufficient communication among the healthcare team, as well as the lack of proper documentation of verbal inquiries of patients' relatives might result in information gap and hence delay in managing the issue. For individual factor, heavy workload, multiple tasks, pressure, responsibilities and tiredness might be difficult to relieve. All of these factors might reduce individuals' motivation to handle tasks focally and follow protocols effectively.
The next step in the cycle of change is implementation. Stage 2 is moving. In this step, it is necessary to move the target system to a new level of equilibrium, by viewing the problem from a fresh perspective, and working together on a quest for new and relevant information. So, who to be involved in the change? Employee involvement seeks to increase members' input into decisions that affect organization performance and employee well-being. In this scenario, all frontline staff and ward managers in the hospital will be involved in the change. Here are some possible solutions to the problem. The first one is to implement a change in the structure. A discharge checklist can be created. Using a discharge checklist to standardize the discharge process, medication error can be minimized. Taking reference from the Tsunkwon-o Hospital, a discharge checklist should include a column for medications. Also, a counter-check and countersign should become mandatory in each discharge checklist. The second suggestion is to implement changes in the process. Education and training can be provided to all frontline staff. First, training should be provided to reinforce the practice of standard discharge procedure. All nurses should be familiarized with the new discharge checklist. They should be reminded again to strictly follow the established workflow in checking and handling discharge medications. For instance, check for any discrepancy on drug record with drug package. Nurses should also be reminded to check the designated drawer for discharge medications daily to ensure that all medications have been given out to the patients discharged that day. Suggestion 3 is to provide education on communication within healthcare team. To enhance handover between staff members, ward staff should document inquiries from discharged patients or their relatives properly, so that other members of the team are aware of the inquiries and can follow up accordingly. Training can also be provided to raise the incident awareness of ward staff. Nurses should be reminded to check carefully when they receive any inquiry from discharged patients or their relatives. They could make good use of the CMS and the per patient summary to clarify any question. In case when frontline staff spot any incident, they should report immediately. Incident reporting has a positive effect on patient safety, by leading to changes in care processes and changes in staff attitudes and knowledge. Refreezing is the third stage. It is to ensure the changes are incorporated into every day. It is high likely that the change will be short-lived and the employees will revert to their old behavior if this step is not taken. Evaluation of changes can be done by looking at the outcomes. If the changes in structure and process are effective, the outcomes would be improved. Error would be prevented and mitigated, hence reducing risks and ensuring safety. Client satisfaction and health-related quality of life may be improved as a result. During the planning and implementation of change, the equilibrium might be supported by a complex field of driving and restraining forces. Habits that are hard to be changed can be the restraining force.
凭借就是这样的性子，这一生都改不了了。
Since competent nurses tend to have a high level of self-confidence depending on what they have inherited by experience or what they have been routinely doing on a day-to-day basis. There are several strategies to evade resistance of change. First, manager should convince people in the change. Based on the assumption that nurses are rational and behave according to rational self-interest, nurses are usually willing to accept a change if it is justified and if its benefits are explained. Note that any successful change is driven by proper communication and the proffering of incentives. Managers ought to clarify information, present the negative consequences of resistance, and emphasize the positive consequences of change. Besides, manager should maintain a climate of trust, support, and confidence. Through keeping appropriate transparency and being open to opinions and revisions, employees can have better sense of control. The active role of employees in organizational change tends employees toward positive feelings, which enhance the employee acceptance for change process.